Live from the KGO TV Broadcast Center, this is ABC 7 News.
Pregnancy can change a woman's figure, but for some, it can be extreme and last for years. There is a new procedure that is helping women bounce back into shape after childbirth. We have that story.
Covering Walnut Creek, Burlingame, Campbell, and all the Bay Area, this is ABC 7 News.
Well, there is no doubt that pregnancy can change a woman's figure, but for some women, that change can be extreme and last for years after delivery. Now, new surgical techniques, though, can help reverse that damage. ABC 7 News anchor Cheryl Jennings has the story.
Some women might appreciate the attention people often direct at an expecting mom. Unless, of course, they're not really pregnant.
People would literally come up to me from somewhere else and ask me, "When are you due?"
Christine, who asked to remain anonymous, is a mother of two from the South Bay. She says her body changed dramatically after the birth of her second child, when she suffered a severe tear in the muscles of her abdomen.
All through here, the entire torso, and it just bubbled out.
These photos show the extent of the damage, which Christine says exercise could not reverse.
Swimming, yoga, walking, hiking, nothing.
And that all feels really nice and intact.
Christine finally turned to plastic surgeon Dr. Kamakshi Zeidler. Dr. Zeidler says the condition is the result of a severe but not uncommon side effect of some pregnancies. It's called rectus muscle diastasis.
And the rectus muscles are the muscles in the abdomen that make the six-pack. And so rectus muscle diastasis is separation of these muscles, which can lead to weakness, but certainly to a fullness and a protruding appearance to the abdomen, kind of like what pregnancy looks like. And this fascia in the middle gets thinned out and stretched out.
Dr. Zeidler says common surgeries pull the muscles back into position with sutures. But in Christine's case, she opted to add an emerging technology as well. It's a protein mesh designed to support the repair.
It's a very strong mesh, but it's not a permanent one. So her body, over the course of 1 or 2 years, will slowly replace the protein mesh.
She says the technique can often allow patients to begin the recovery process more quickly after the surgery, strengthening the muscles with moderate exercise.
She wanted me to walk the day of the surgery, and walking was good, so I was all in with that.
Okay, so go ahead and lift your head off the table. Great.
For Christine, the difference was noticeable almost immediately after the procedure, with the bulging from her tear flattened back into place. A cosmetic improvement she considers life-changing.
I went out to a restaurant and I didn't have to ask someone to move their entire table for me to get by.
Full recovery can still take several months, but with work, Dr. Zeidler says patients can recapture their normal figure.
And I think that she'll have more success in regaining muscle tone in her abdomen, and that her results may even be better than they are today.
Cheryl Jennings, ABC 7 News.
Now, something to keep in mind, even though the tearing is the result of pregnancy, the repair procedure is often considered cosmetic and therefore not covered by insurance.